Hello, I'm Catherine Hendy, co-founder of ELANZA Wellness, and I am very delighted to be joined today by Dr. Marcia Inhorn. Welcome.
Oh, thank you. I'm delighted to be here.
So, firstly, Dr. Inhorn, I'd just love to start by asking, how did you find yourself in this speciality?
Yeah, there's a wonderful subfield of the social science of anthropology, which is called medical anthropology. And similarly, in sociology, there's a subfield called medical sociology. We are the researchers who are really interested in people. We put people first. And so we do research, often very in-depth interview-based research. With people who are going through various health problems, treatments, experiences of health and illness. I started a long time ago, 30 years ago, by getting to the country of Egypt just on the cusp of the introduction of IVF to that country. And I actually started working in a public maternity hospital that had opened up an infertility clinic for the poor. And eventually, soon in 1991, they birthed their first IVF baby. And I, from that point on, really have been sort of traveling with IVF and other IVF related technologies like ICSI to overcome male infertility. I've sort of been traveling with the evolution of the technologies not only across the Middle East, but into the US. My last two studies have taken place in my home country. One of them was with Arab American infertility patients. And then most recently, I've completed a large study actually with colleagues here and in Israel on egg freezing, women's turn to the new technology of egg freezing. So I have interviewed over 30 years, literally hundreds of infertile couples, women suffering from infertility, men suffering from infertility, the couple's sort of perspective on infertility, and issues of access and traveling for infertility treatment, and just, the various types of problems that people encounter. And I have, through that, a pretty keen sense of what people struggle with, what they care about, what they wish for in their treatment journeys. And then again, now that I've really turned most recently to egg freezing, I've learned a lot about what women desire in terms of what you might call patient-centered egg freezing. So most of my research, I don't do surveys. I actually sit for hours with people talking with them. And at this point, it's literally hundreds, probably thousands of people that I've talked to over a very long time period.
There's so much here that we can dig into. But given that you mentioned it just there, let's perhaps talk first about egg freezing. What sorts of things have you found in this area from the interviews that you've done?
So our research in my American part of this study, where I interviewed 150 women, mostly doing egg freezing for so-called elective reasons. In the world of egg freezing, and really all the studies are showing this, women who are turning to this new fertility preservation technology are doing it. The reason is that they're single. They don't have a partner. They're women who would like to be mothers of biogenetically related children, but they just haven't been able to find a reproductive partner. It's really what we might call the mating gap or the missing men problem in educated women's lives. And so these are women who are trying to figure out what to do. They're usually in their late 30s by the time they get to egg freezing or start considering it. And I think the main issue for patient-centered care for this particular demographic or this particular population is that more or less IVF clinics, which is where the vast majority of egg freezing is taking place, it's in IVF clinics. IVF clinics are really a couple's place. It's a sort of couples-oriented world. I mean, most infertility is couples infertility. And so women and their husbands or their partners are appearing together in these spaces. And for women who are pursuing egg freezing, they're generally on their own. I mean, they're single, they don't have the husband or the partner. And entering that world, that very couples oriented world, can be extremely alienating. It can be, doesn't feel like a safe space if the clinic has not made provisions to really tailor their protocols for this egg freezing population. And just small examples, but they're painful in a way. Consent forms where you have to sign off on what you plan to do. In IVF, there's often a second line that says husband's consent. And, if the sort of same consent forms are used for single women pursuing egg freezing, they feel bad. I don't have the husband to consent to what I'm doing. So that's just one example, of the kinds of things that women care about. About a third of people coming into egg freezing have gone through what we might call a relationship trauma. I mean, 1/3 of women were divorced, separated, in very unstable relationships. It was, the relationship wasn't going well or had just ended. And so quite a few of these single women are single because they were in a relationship that ended. And again, I think just being sensitive to that, what you just explained, that you weren't a missus at that time and you didn't have the husband to accompany you. And again, in egg freezing as an IVF, on the days that the eggs are retrieved, surgically from a woman's body, there needs to be an accompaniment. There needs to be somebody there to take, accompany the woman home after the small surgical intervention. And again, that was very difficult for women who are single. Like, if you're living in a city and all of your friends are busy at work, who do you ask? You don't have the partner to accompany you. So there was a lot of angst, about these tiny issues. But women that I spoke with really felt that clinics could be doing a better job to sort of anticipate some of those issues and to really sort of tailor fertility preservation for a separate kind of population of women who are going through it alone. Woman only injection classes for the women going through egg freezing, because there's an assumption that, oh, the husband's going to help with the hormonal injections. Well, what if you don't have a husband? So there are many things. I mean, honestly, we've written a whole article, but there are many things that women felt would make the practice of egg freezing feel more patient-centered to them.
There are areas of language that people have picked up on as being quite painful experiences.
Yeah, absolutely. Just the kind of, how are you being designated by marital status? I mean, that's a huge thing. I also have to say that, you know, in the US context, people were concerned about diversity issues. I mean, you can't assume that everybody coming to egg freezing or to IVF is straight. There are, obviously gay men and women, lesbian women who are needing assisted reproductive services, minority women. That was a huge issue in my study. Just, it's a diverse population that is, turning to egg freezing, but I think clinics could do a bit better job in sort of recognizing that diversity and some of the issues that might pertain to particular ethnic, racial, religious, sexual minority groups in a diverse world in which we live. I mean, for example, Black American women often said that they saw some diversity in the clinic populations, but that they rarely saw other Black women. And it would be very nice to have, some sort of support structure in place so that Black women could feel that they were not alone in this process. People who are religious minorities, all of these things do matter. And so just having somebody on staff who's knowledgeable, sensitive, a more diverse staff, more women, more people of color in these practices, I think would be helpful and supportive for many women. Yeah. And so, people want to have relationships too with clinicians who they feel that they can talk to in a respectful manner, that they don't feel rushed. And, for many people, they wish that they just had one person, one clinician that they could go through the journey with. And I think something that happens in very large, busy clinics is that there's a sort of fragmentation of care where you're not necessarily with the same person who knows your situation and story. And so that was another issue that, women often were very happy when they had one clinician who they appreciated and they stayed with from the beginning to the end of their process.
I just want to turn to some other area of your research. I know that you looked at the male experience of fertility a lot and notions of masculinity. What's been some of your interesting findings there from research and interviews?
Yeah, first of all, I just feel that we underestimate the importance of male infertility as a male reproductive health problem. I mean, male infertility contributes to more than half of all cases of involuntary childlessness worldwide. It is not something that's infrequent. I mean, there are millions of men with male infertility problems. And just to be clear, male infertility problems are usually not sexual problems. It's not erectile dysfunction or impotency. When we're talking about male infertility, in most cases, it's problem with spermatozoa, low count, low movement, misshapen, and sometimes there are men who are azoospermic. They don't have any sperm in their ejaculate. And, these can be very intractable problems. Many times they're genetically based, and there's not a whole lot you can do to actually treat male infertility. And so the solution, if you will, is ICSI, intracytoplasmic sperm injection, which is a variant of IVF. It was developed in Europe and Belgium in the early 1990s, and it's been around now since the early 1990s. So it's been decades, and no one really talks much about it. I mean, outside of maybe the world of IVF, we still don't talk very much about male infertility. Most people just assume that infertility problems are women's problems. We don't think about men. And, for men, it can be very emasculating. It can be very stigmatizing to be infertile, and also very sad when you feel that you're preventing your beloved partner from becoming a mother, having children. And so male infertility is just an underappreciated problem in our social science world, where there's so many books now published on infertility in countries all over the world. There are literally 2 books that really look at male infertility as a male reproductive health problem. I happen to write one of them based on a big study I did in Lebanon. And in the Middle East and in parts of South Asia, I mean, there's a lot of male infertility. I mean, some of it's due to smoking and environmental risk factors. A lot of it's probably genetically based, and it's a cause of suffering for men. And so my big finding, I have to say, my big takeaway from having studied male infertility for a very long time, it sort of started in Egypt and then I moved to Lebanon, is that men, now that there's ICSI in the world, and ICSI has moved, it got to the Middle East by 1994, men, once they found out about the technology, they eagerly embrace, assisted reproductive technologies. It's not like men are reluctant to participate. They want to do something to overcome their problems. And so I coined a term, emergent masculinities. We need to be looking at the ways that masculinity is changing and evolving and sort of taking new forms in places where maybe it's unexpected. But in the Middle East, in the Muslim world, men are using ICSI. I mean, clinics are full of men who are there for male infertility using ICSI. And I think we just need to be talking more about it. Even in America and in Europe, male infertility is still very hush hush. There's not enough attention to it. And we just have to remember, it takes men to reproduce. I mean, men are women's reproductive partners, and so we should be attending to them. And we should be thinking about how they feel in IVF clinic settings too, which can be very woman-oriented in some ways. The attention's on the wife often, but what is the role of the man in that clinical setting? There's a certain alienation that a lot of men feel, sort of being there just to provide their sperm. And I heard a great deal about men's perceptions of how they would like things to be a little easier for them too. I mean, the unfortunate part of ICSI, it is a variant of IVF, and IVF is a very female embodied process. The hormonal stimulation of the ovaries, the, retrieval of the eggs, the, transfer of embryos. ICSI requires the woman to go through all sorts of invasive procedures. And again, men often feel very bad about that, like, oh, my wife or my partner's having to go through so many things. It's because of me, I'm to blame. But it doesn't mean that men don't go through things as well. I mean, men who are azoospermic, who don't have any sperm in their ejaculate, have to go through testicular biopsies. They go through, forms of, things in their scrotums, their testicles that are painful and difficult. And so it's not completely, men put their bodies on the line too. But yeah, I would say the, disparity there is that women do have to sort of go through a lot when their husbands are infertile. And I guess for me, the big story of my years of research, working with infertile couples, is that in some ways, infertility brings couples together. Sometimes infertility is like a bonding experience, especially if you're sort of new to your marriage and you're trying to have a baby and it's not happening and you're in love and you're having a lot of sex trying to have a baby. It brings people together, and then they recognize that there's a problem. There's often a lot of compassion and empathy when it's discovered, and wives try to help their husbands if it's a male infertility problem, and similarly husbands try to help their wives if it's a female infertility problem. And again, I found that in all the research that I've done in the Middle East, where the assumption is always that, oh, men are just going to abandon or divorce, infertile wives. And similarly, I mean, that's not true. There's often incredible commitment within infertile relationships. And people go through rounds and rounds of IVF sometimes together, just in that hope of having a baby. And I've actually seen people traveling, I mean, just doing incredible journeys because they couldn't get access to IVF or ICSI in one country. So they use their life savings to go to another country. And we know that that's happening in Europe. There's a tremendous amount of repro travel from one country to the next. And I always feel like that wouldn't be happening if you didn't have this, commitment within relationships and partnerships that I've certainly seen in my own work on infertility, that often it doesn't break couples apart. It actually can really solidify love and commitment and endurance and faith and that sort of thing.
Speaking of faith, and I know that you've got such an incredible global perspective, have you found that religious, moral, and cultural sensibilities can actually impact people's experiences of fertility or infertility?
Yeah, that's such an interesting area. Thank you for asking that question. It's very interesting. If you look globally at the sort of major religions of the world, the Abrahamic traditions, which would be, Judaism, Christianity, Islam, look at Hinduism, Buddhism, the Protestant forms of Christianity. There's been globally, I'm going to say, pretty major acceptance of assisted reproduction. Virtually every major religion, has had some sort of a proclamation or decision making or pronouncement about this technology. And in the vast majority of cases, they consider it okay for married couples to, do IVF, or, usually within the bounds of marriage. The one religious tradition that doesn't accept assisted reproduction still is Catholicism. The Vatican and the Catholic Church and clergy have decided that it's not acceptable to use this kind of reproductive technology, assisted reproductive technologies, but no reproductive technologies are considered acceptable in the Catholic tradition. It doesn't mean that IVF and all these other things are not being practiced in Catholic countries. They certainly are in Italy and France and in South America, but that's really in direct confrontation with the teachings of the church. But it matters. Like, I've interviewed many Catholic couples and women, Catholic people who were raised in the Catholic tradition, doing egg freezing, and there are sensitivities around, oh, I know I'm not really supposed to be doing that, especially around embryos. What does one do with, what to do with embryos? So, that's one issue, sort of what is prevented, what are the traditions that disallow these technologies. I work mostly in the Muslim world. And again, maybe counter to stereotypes, Islam has been very, very permissive toward assisted reproduction. From the very beginning, the first Islamic fatwa on IVF was issued in 1980, only 2 years after Louise Brown was born in England, and basically said this is good for Muslim couples to overcome the problem of infertility as long as it's being done within the bounds of marriage. So that was a sort of major, statement. Okay, as long as you're married and you're doing this within the course of your marriage. And in the Sunni Muslim world, which is the majority, it's probably up to 90% of the world's Muslims are Sunni Muslims. There's IVF all over the Sunni Muslim world. And in those cases, they do everything except third-party reproductive assistance. The Shia Muslim world, which is sort of epicenters in Iran, decided that even third-party reproductive assistance is okay. And so there you'll find egg donations, sperm donations, surrogacy. So, we've written a lot about Islam and ARTs, but it just goes to show that, religious traditions, the religious establishment is often in a very interesting, they debate these things when they come out, and they think about, what's right and wrong, and they make decisions that do really affect people in their sort of local moral world. So yeah, Muslim couples they've been doing IVF in the Muslim Middle East since 1986. And there have been, millions of Muslim IVF babies born. And similarly for Catholics, even though the church still doesn't like IVF, IVF is being practiced widely throughout the Catholic world. And, you could take any religion and talk about it. India is the global epicenter. India has more than 1,500 IVF clinics, the largest number of any country. And you've got, a large Hindu population, which allows, IVF. Muslims in India also practice IVF. So basically, yeah, IVF has really spread around the world with the permission of most of the religious authorities, including Jewish religious authorities too. Israel has the highest per capita rate of IVF of any country in the world, with the help of the, Jewish clergy.
So really what you're saying is that people of every culture, every nationality, and every religion could be seeking care, and clinics have to be aware of that to be able to serve every type of patient.
They really do. I mean, you've stated it absolutely correctly and succinctly. I mean, people of every tradition are trying this technology, and and clinics do need to have some knowledge about what the major traditions do and do not allow. I mean, for Muslims, for example, I've spoken quite a bit in the US and in Europe about, Muslim permissibility and the differences between Sunni and Shia Islam in terms of what's allowed and what's not. And it does actually matter, because we have our own Muslim population in America, and there are actually people traveling from other parts of the Muslim world to the US to get technologies here that they can't access at home. And so, clinicians need to be aware of what is allowed and what isn't, and how people feel morally about, trying this or that. And there is a lot of sensitivity in some traditions, Christian traditions, around the embryo, that the embryo is human life in some traditions. And so, the creation of embryos, what to do with excess embryos, embryo disposition, embryo adoption, these are real moral concerns for some people going through IVF that, again, I think clinics need to be highly aware of those kinds of concerns on the parts of patients.
As a clinic, how do you bring more humanity into the process, and how do you make sure that you're serving everyone individually?
People often use the term, it was like an assembly line. I felt like I was in a factory. I've heard that actually not only in the United States, I've heard that, women who tried IVF in India, I mean, women in Egypt. I mean, this is a problem when a clinic is very busy and has huge patient demand and really not enough staff. I believe that in addition to having IVF physicians, the ones who are the, main clinicians in a clinic, there should be a lot of support staff. Nurses play a vital role. I think we underappreciate the role of IVF nurses. Embryologists can play a vital role in terms of patient education. And I've seen some good examples of that where embryologists actually do interact. They don't just stay in the lab, they can do some sort of patient counseling. And I think there is a need for good counselors, psychologists, social workers who are working in clinics and have time, and appointments set aside for talking with people. I mean, it's very important. For example, in the state of Connecticut, where surrogacy is allowed, as opposed to some other states where it's not allowed, you really need to have a person on staff who knows the ins and outs of surrogacy and the legality, and really can be dedicated to dealing with traveling couples coming for surrogacy to the state. So a good clinic will have an expert who really can deal with that. And, again, if IVF clinics that are located in major cosmopolitan cities like London or New York or Washington, D.C., where you've got the world in those cities, you need to have staff members who are comfortable and have expertise in particular populations of patients. Coming, to the clinic. I mean, be it a South Asian immigrant population or, a Muslim immigrant population or, whatever. I mean, clinics that do a lot of work with LGBTQ populations, again, you need to have somebody who really is sort of specialized. So I think that's what women have said to me. I wish there was just more support, that there were people who looked like me, who understood my situation, who I could talk to. Because the clinical part is, as you said, it's very clinical, cut and dried, and it's often occurs too quickly. So you don't get the sort of time to have the extra attention that you sometimes need. So even if there are resources outside of the clinic, but just how do I get there? How can I get some help? I mean, women often find support groups invaluable, online, chat rooms, ways that they can connect with other people who've gone through what they're going through. And again, being connected, one of the sort of criteria, there's this world of what's called patient-centered infertility care, which has really been forwarded in Europe by Belgian and Dutch investigators, who've really said we need to have patient-centered infertility care. It has many, many different dimensions to it. There are sort of 7 system dimensions to patient-centered infertility care, and there are 4 human dimensions. And, so there's been a lot of work about, what makes for good patient-centered care that patients themselves feel comfortable with. And issues of coordination, integration, that the clinic is not just working as a silo, but is connected to outside worlds, so that if once you get done with your appointment, there are other resources outside that people can feel comfortable.
Thank you so much for being here, Dr. Inhorn.
Thank you. It's been my pleasure. I really enjoyed our conversation. Thanks. Bye-bye.